prostate cancer is the most common cancer in men. And when I met with the Prostate Cancer Support Group, many of them said the treatment has not been explained to them properly. I'm Zeinab. I'm the pharmacist and co-founder of PillSorted. And one of the best places that I found that I can support people with their medications is the different support groups. So these are usually based around a common condition like cancer support group, Parkinson's support group, MS support group. And what it is usually it's a group of people that have become comfortable. They're at different stages of the same journey and their questions are quite honest. It's a comfortable way for them and a comfortable setting for all of them to ask useful questions. What I do is I usually start with a couple of practical pointers, and this changes, be it a seasonal question or if it's a question that the group have asked about, for example, bowel movement or better sleep. And that usually opens up to my favorite part, which is the question and answers, because it's a whole person that's going through that treatment journey. So we discuss treatments, the medication, side effects is a very important one. If there's questions that I don't know, I will look it up and find the research and evidence of why is this happening, and will support to find a good framework. So is this a new niggle that you're having, a serious thing that we need to look up? Is this something that you can do something about it yourself? And the good thing is we know the language of the doctors as well, so I can support you put that into words, how to communicate it with the consultants and the doctors as well. So in this new series, what I'm going to do is I'm going to briefly explain the group that I visited and what were the practical points that I've explained about, but most important, a couple of those questions and answers that I think will be useful for everybody else. I visited the Prostate Cancer Support Group in the Cancer Support Center here in Shelford, Cambridge. It's a beautiful setting, lovely men. We discussed some practical tips about the heat wave and medication, how to store it, and some of those actually affect their treatment. So hot flushes and dehydration are really important things that sometimes they come up because of the treatment, and the heat wave can make it worse. And these are the 3 questions that made it to my list, so I thought I'll share it with yourselves as well. One of them was actually, I think, really important, is what is the treatment actually doing? So this is a really important question, and because prostate cancer is so common, I think it's really important to explain it properly. Most of the time the prostate cancer is fueled by testosterone. So what we want to do is we want to shut down the testosterone so that we deprive the cancer cells and we can reduce the effect they have on your body. For shutting down that testosterone, there's 2 important ways. The most important way is it's got a control center in our brain, like a lot of other functions that have got control centers in our brain, and that control center will tell the testicles to make less testosterone. So it might be a tablet that you take daily, or it might be an injection that is done once a month, or different versions, but that's generally what the medication is trying to do. It starves that cancer cells from testosterone. Now the trade-off is testosterone is a hormone that does a lot in our body, and a lot of the side effects that you feel, like the hot flushes, like the sweating, the tiredness, and losing confidence, or as the way that some lovely men were putting it, feeling soft or teary-eyed all the time, this can be because of that lack of testosterone. Now what I want to assure you is it is a normal thing that we're expecting to happen. It's not comfortable, it's not convenient, but it is something that is expected because testosterone does so much in the body. When you don't have enough of it, you will see a wide range of different symptoms happening. If any of them become really unbearable, talk to the prescribers. There's lots of things that we can do to alleviate those different symptoms, okay? But what I don't want you to do is to go and buy supplements that will boost that effect. So for example, some things like saw palmetto, too much of the magnesium and zinc. There's lots of different supplements, and these are advertised as making you stronger or all of that, but they can affect those cancer cells not getting deprived. So don't go about buying supplements trying to recover from this. Come and talk to any of those symptoms that are worse for you, and we'll try to alleviate those, okay? Even the dosage of the medication and treatment can be adjusted as well. So that's how usually the first line of treatment is. is. And according to that, there'll be lots of different things that might be planned. The second question was alcohol. So a lot of men enjoy alcohol, and once they're going through something, an event or, a trauma like that, sometimes they don't realize, but their alcohol intake becomes more. And the question was, is alcohol really that bad? Let me tell you why, okay? So it can stack up the same problems that the hormone therapy is already causing for you, okay? So there are a lot of evidence that shows that the pathways that the sexual hormones like the estrogen, like the testosterone have on the insulin levels on our body, okay? So what I want to say is insulin resistance, weight gain, and muscle loss are the three specific important things that actually alcohol makes worse, and during hormone therapy you'll get them getting worse as well, okay? So you don't want to stack them up and you losing more muscle, you're gaining more weight. And the other important thing is the actual sugar craving. So it does increase your sugar cravings. That will not support your body in the recovery, in the healing, and going through all of this treatment. So the more that you can cut it down, the better, but make sure that you try to have a good sugar control as well, okay? So that you don't get worse effects on your sleep, on your weight, on your mood because of the alcohol. The third question is, what can I do for my mood? A lot of men feel really, really tired, feel they have lost a lot of joy in their life, and you're going through a lot, okay? So that's another important thing. So I think in general, antidepressants can be a very helpful way, okay? And it's good definitely to talk about it to your doctor, because it can take the edge off you being so hard on yourself, because a lot of the times it's about, why can't I do this when I used to be able to do it before? Those antidepressants can help settle and get you through this episode. The other important thing that I wanted to talk about, and sometimes men underestimate or don't do as actively as women do, is getting together. So having groups that you can sincerely talk about what you're going through is really, really important. Isolation is one of the biggest issues that happen to men, especially as you put on age, especially when you're going through treatments and conditions. Trying to power through it all by yourself is really tough. Actually going out to these support groups is really important. I know there's not that many structured ones still nationwide, but there is a lot of support that can come through the different foundations, trusts, or the Macmillan support groups, and it's definitely worth that regular conversation with people that you feel comfortable with, that you can discuss and share the different stages of the journeys that you've been through, okay? Now, in addition to the cancer specific groups, there are groups like the Samaritans or even 111. They're really good at signposting you to the right support, okay? So definitely, if you feel lonely, it's really important to talk about it and reach out to other people. There are lots of people that are sharing the same experiences and share the same loneliness as you are. Okay, so as a recap, the hormone therapy works by switching off the testosterone that the cancer feeds on. What we want to do is to manage the symptoms. Alcohol cutting is a really good thing to do, and be careful and monitor your sleeping and your nutrition and your sugar intakes, and reach out to other people and get yourself into a support group that you're comfortable to be able to speak about the shared experiences. If you've got any question, feel free to reach out to us. If there's a group that you'd like us to get involved and share and explain medications, again, reach out to us. Subscribe to our channels for that clinician-led health advice. Thank you.